morning. It's nice to hear your voice. How are you?
Good.
Good. Okay. It's nice to see you and thank you for the opportunity to be here. I'm really honored to discuss this topic. I know everybody could be relating because more likely we could be sharing some experiences, or you might have witnessed somebody experience some experiences that individuals are encountering with regards to mental health. And with that, here's the title of our presentation for today. It's about healing beyond boundaries, the mental health perspectives in Asian American and Filipino communities. Okay, so let's try to take a look at the demographics and diversity among Asian American and Pacific Island. In the research, taking a look at the number of the individuals, it is projected that there are over 24 million Asian Americans today, and this number is projected to more than triple by 2016. Okay, so it's really continuously growing at this point. And Filipino Americans are a major subgroup with 4.2 million individuals, and especially they are concentrated in California, New York, and Texas, while Asian Americans as a group have a higher median household income and educational attainment more than the national average. And at the same time, with regards to the AAPI community, since it comes from diverse group and background, we also expect them to practice certain religion. So there could be Christians, there could be Buddhists, there could be Muslims or Islam, and many others who could be unaffiliated. And this influences, whether we admit it or not, are great factors for affecting the beliefs of individuals on certain practices, particularly in the state of mental health. Later on, as we go on in the discussion, we're going to take a look at some cultures which are strongly inculcated in our lives that greatly affects our practices with regards to mental health. So, next, take a look at this. Let's just have like a quick review. Let's try to identify which part of Asia did we categorize ourselves. East Asians. Can I see hands of those who are East Asians? Okay, nice. Okay, what about Southeast Asians? I'm also from Southeast. Are there Filipinos here? Nice. Kamusta? Next, what about South Asians? Are there South Asians here? And Pacific Islanders. Okay. Next, let's take a look at that. So even though we come from different places in Asia, we could have similarities. Later on, you might be identifying, oh, it also happens in my country. It's the same in my country. But there could be really some differences that is a strong hold with regards to the foundation on how we behave and what we believe with regards to the practices that we have. Next, let's take a look at the cultural values and mental health. The cultural values mean that even when services are available, because of these values, which we'll later discuss, maybe some might not even consider seeking for mental health consultations. Always remember this, our mental health is as important as our physical bodies, right? Like for example, you have a fever, you need a medication for fever, a paracetamol, so that your symptoms will be gone, your temperature will be back into the normal one. And since mental health is very important, just like that, then it means there must be a proper intervention that the individuals should be encountering and should be enjoying at the same time. Now, let's take a look at the cultural values that Asians or AAPIs probably possesses. First, saving face. We want to preserve family reputation above personal needs. Have you experienced this? You do not want to put your family member into shame, right? Like we would say, oh, I have to make sure that what I do is right because it will include all of my family and I do not want them to experience such kind of things because of me, right? So that's a culture. That's part of our belief and our practices because we really take value and take pride of our families. Well, that's one good thing that we really value our families, we really value our connectedness with them, but there are also instances into which it hinders us from seeking mental health consultations, right? Some family members are not open to these practices. They would say, if you are suffering from that, maybe you should increase your prayers, maybe you should increase your faith, especially for religious families. Maybe you're no longer doing certain practices or activities that diverts your mind towards something else. And make sure what's in the family should be kept in the family. Of course, it depends if some of the families I know are already very much open, very much welcoming different perspectives, but there could be some, particularly the very traditional ones, would still stick to such kind of practices. And it would make a person feel like, okay, I have to contain it within myself, I have to save it within the family, and I could not just dispose it to anybody else. Okay? Next. Collectivism. We all know that, particularly, we prioritize group harmony over individual well-being. Take a look at the traits of a collectivistic culture. First, the social rules focus on promoting selflessness. So we want everyone to be in harmony. That's why sometimes when we speak our minds and our opinions are different from their opinions, instead of having disagreements which we do not want to happen, some people would just decide, okay, I'll just keep quiet. I wouldn't insist what I think and how I feel because I do not want some unpleasant connections between me and this person, particularly if it's a family member or a friend. So it's part of it. Next would be working as a group. And you could also see in the family structures, right? Like in other places, it's not just a nuclear family. It's an extended family. I know you know that, or you might have grown in such kind of family. You have your cousins with you, you have your relatives with you, and it's really hard to disband, right? Because of the attachments. Next, doing what's best for society. And families and communities have a central role. Maybe you have known some, or maybe you have experienced it, like even the child is already married and has gotten kids, they still live with their parents, right? Like in my case, when I was still in the Philippines, like since I wasn't married then I stay with my parents, even if I'm a grown up, right? And of course, living with your parents would mean you have to obey and follow whatever rule is inside the house. Of course, you could not just say, I'll do what I want, I'm a grown up. It's not like that, right? However, we are, whatever age we are in, our parents would say, even if you are 50 years old, you're still my kid, right? Yeah, that's true. And I know that you could be relating about that, or you might have some experiences on that. But of course, we know that they love us so much, and that could be one way of showing your concern. Next, silence. To prevent further issues, to prevent further disharmony, okay, I'll keep my mouth shut. But deep inside, since you could not release it and you could not process it and talk about it, it might be breaking you already, right? So that's one resort that people try doing, just to keep quiet, okay? I'll be hands off over that. I'll just deal it with myself. So it's one of the things. And emotional restraint. One good thing about the AITI is that we possess the characteristic of being so resilient and so patient, right? We would say, okay, I could not control this thing, so I let it happen. But I do believe that what can I do at the moment are the things that I am capable of controlling. I'm so resilient, I could bend, okay, I could adjust, right? It's one characteristic. However, these things would also hinder ourselves from trying to take a look that something must be put into proper order, especially when it comes to mental health. Okay? Now, I know you might be experiencing stressors in life. Are you stressed right now as final period is here? Okay, so he's nodding. No, not at all. Others could be okay. I have a lot of things in mind. Others might be here while thinking, what about the next hours of my day? How should I utilize it? I have a deadline for tomorrow. I haven't done it yet, and I have to stick to the schedule so I could finish it. Others could also have problems like relationships, either if you have partners or not, within your family, within yourself, your internal pressures. So come to think about this. First, what could be acculturation? Navigating between traditional and American values. So of course, it really depends. If you have grown up here or you have grown up in your original country first, and then you just moved in here at a certain age. And also, it depends on how the upbringing of the parents could be. Like, for example, if they live there in your home country for a period of time, and then they move in here and they are disciplining the parents. Hi, good morning. Good morning. They are disciplining their kids, then they might still utilize the upbringings that they have encountered when they were in their home countries. And you, individuals, interacting with Americans, with pure Americans, and people with different culture, and having the discipline of your parents, which are very traditional or which could be very strict, then it could be something very opposing on your part. Like, for example, in most Asian countries, we use honorifics. Like, we call our elder brother or sister with other names. Like in the Philippines, we have ate or kuya, right? I also know in other countries, you have to say words which are more respectful when you are talking to an elderly. And it could be different if you just call your mother-in-law the first name, right? They would say, oh, you're disrespectful. Why are you calling me with my first name, right? If you will not say, hi, ate means an elder person, an elder sister. If you will not be doing that, then you may be tagged as disrespectful, right? But in here, of course, it's totally different. So what if you have been used with that setup and you are trying also to weigh in the practices that have been inculcated on you based on your original race? Then that could be a stressor if people are not open to what could be going on. Okay? Like, for example, when you visit a traditional Filipino house and the parents are there, you have to show up with the parents and say, hi, good morning po. Okay? Or you have to take the hand of the parents and put it on your forehead as a sign of blessing. And before you leave, you have to show up and say, goodbye, I'm going now. But here, just go into the house, go out, and that's fine. That's not a problem. That's not an issue. But come to think about that, with those differences, it could even add stress if there will be some individuals who might not be open to the differences that people are encountering as well. Next, so it also involves intergenerational conflict. What if your parents have different concepts on education? What if they have different concepts on dating and relationships? What if in your country, in your home country, it's very traditional, very conservative? Okay? You can't just go out with the person you are dating if you are only two. But here it's entirely different. If the mindset is entirely different from what is in that situation, then there could be a conflict. And that could be a stressor as well. In other Asian countries, they still practice fixed marriage, right? But even in other places, of course, it might be open. Well, it depends on how individuals would take that, including the culture in the place you're living right now and the culture that you have not only in your house, but also the culture that you have based on your heritage. Next, we have here model minority myth. The pressure to excel academically and professionally. Whether we admit it or not, we are so competitive, right? I want A grade, right? I want high scores. And more likely, some of these students, especially if they are raised by their parents in a traditional way, they want these kids to be very holistically excelling. Like, for example, I am not just, a person will not be just good in school, but a person will also excel in sports because after the class, the parents would be sending them to sports classes or music classes, like playing the piano, playing guitar, voice lessons, and so on. There's a lot, right? So it's also rooted in our culture that we value those things. We connect it also with the family. We might be saying that I have to do well because my parents have worked hard to support me in the endeavors that I am doing. And as a return, I have to make it good. Now, if your parents would be saying, don't be pressured about things, okay? Just take it easy. However, since you have been raised to excel, internally, you have your own thinking that you want to excel and you want to be on top. Like, for example, a 100 item examination, you got 98. Definitely, you should be happy. That's a high score. But sometimes, if you are really experiencing high internal pressure, you might say, I missed 2 points. I could have gotten a perfect score. Right? So, come to think about that, then that could cause you anxiety as well. Because first, instead of being happy of that, you still aim for something even better. Okay? And of course, anywhere you live, there could be discrimination at the same time. So people who have different beliefs and practices and who are not open to what is going on with different places of the earth could not be understanding why not everybody are the same. Okay? And they might be saying something against you, whether you admit it or not. Even in your own country, you might be experiencing discrimination anywhere you are. So it depends on that particular culture and that particular mindset of the people. Other people would not even like to stay in their home countries because that's where they experience bullying, that's where they experience great discrimination, that's where they experience not feeling safe and not feeling at home, right? So take a look at this. What about the rate for mental health service utilization across racial groups? Take a look at this. White Americans, 50%, they occupy the greatest percentage of those having mental health utilization, mental health consultations or utilizations. Next, African Americans, 35%, Latino Americans, 33%. And take a look at Asian Americans. They offer the less or the least percentage. Does it mean they are not encountering mental health issues? No, it could be rooted in the culture that there are barriers that's stopping them from accessing mental health services because of the culturally rooted characteristics. Okay? Next, here are some of unique stressors affecting mental health by different groups. Asian Americans could be bimodal minority myth, immigration stress, discrimination. Latino Americans could be acculturation stress, immigration fears, discrimination. And then African Americans could have historical trauma, racial profiling, systemic racism. And white Americans could be economic stress and regional disparities. Next, let's take a look at the common barriers to mental health. Take a look at this. Asian Americans, it's mentioned that one of the greatest reasons would be stigma. Okay? It's still in the mind of most Asians that when you consult for a therapy or seek for any psychological help, people could tag you as crazy. Right? I know in your countries there could be terms referring to the word crazy, and you might not want to hear that, right? And sometimes name calling is also very rampant in each of the places whenever it's all about the talks on mental health. Like, for example, you know you are depressed. When somebody asks you, you would just simply say, I'm okay, I'm fine. Or you might just tell yourself, I feel sad, but not really say, I feel depressed. Others might say that, but others might be hesitant. Or others might even conceal that mental health problem by just providing answers about the physical health to cover up the mental issues. Like, for example, how are you today? You know that you're having a depression episode. You might be saying, I have a headache. That's why I could not go. I don't feel well. I feel sick. That's why I'm not able to deliver it. So come to think about that. Okay? Next, language barriers. So we all know, of course, we speak English, but there is still something about your language that could not be directly translated to English. Or if it's translated to English, it could change the meaning, or you could not really express how you really feel when you're speaking the second language, right? Of course, it's entirely different when you're speaking your native language. The emotions are there. If you're so happy, you could show that you're really happy, even with the tone of your voice, even with your facial expressions. But when you're translating something, imagine you have to cry and you have to explain, translating it into a different language, then that's another task that might make a person feel okay. I'll just leave it instead of translating. I'll just leave it behind. Okay, things could be like that as well. Next, there could be a shortage in the number of culturally competent providers. Why? Of course, as a provider, you also have to make sure that whatever intervention you're going to do with a certain client is very much tailored with that individual. Like, for example, 5 clients or 5 patients are suffering from depression. The intervention could not be the same all throughout these 5 people. Why? That's why we have to get a proper diagnosis and proper assessment of the characteristics, the historical background, the socioeconomic issues, the familial history, health history, all of those things, so that we could think of what would be appropriate for this individual. You have to adjust particularly what kind of intervention should be carried out for that particular person, depending on the history that you're going to take within that individual. So make it more effective and to make it really work for that person. One intervention could not be appropriate for this individual. Like, for example, you thought about diverting attention through doing things that enlightens your spirit. And one person says, I feel enlightened when I go to church and pray. Okay? So one task of adjusting the intervention could include those practices that the person is talking about when it comes to religion or spirituality. But you could not apply that if the other person is not much into such kind of practice or do not believe in such kind of practice. So adjustments must be made and should be necessary. Next. So barriers, like what we have mentioned, language could be one. Others could feel shy also speaking up. They would say, I'm not fluent. I feel shy expressing myself and using this language. So instead of talking it to somebody out, then I hesitate doing so. Another, there could be cultural competency gaps. Providers could be unfamiliar with some Asian cultural nuances, things which are specific to Asians as well. Financial constraints. Reality speaking, it's costly to get yourself into therapy, right? A single session could be so expensive. And of course, if you do not have insurance, you have to pay it cash, or some would not be even considering getting insurance for this because they would say it's too expensive and they might not be utilizing it anyway. Okay? Geographic limitations, far-flung areas or places into which the access to mental health services are limited. Although, of course, there are remote mental health services which are being utilized right now. But of course, it's different when you are talking to somebody face to face and when you are talking to somebody online. Okay? So there could be people who are also feeling so comfortable saying and admitting that I am going for some psychological therapy at this point. But there are some people who really do not want to tell anybody that they have consulted a therapist. Okay? Because for some, they are afraid that maybe they could be labeled by other individuals as something who is crazy or insane. So take a look. I would also just like to share some Filipino-American specifics. Bahala na mentality. So it's a term, it's a Tagalog term. Bahala na. It's like leaving problems up to God. Okay? Or, okay, I'll just let it happen. Rather than seeking help, it's highly more on a faith-based approach to handling life's difficulties. Of course, in the Philippines, as an example, it was colonized by the Spaniards for 300 years. So that's a long year, that's a long influence. And at the same time, one major contribution that they have given was religion. That's why many got converted to being Catholics. And since religion is deeply rooted into the culture of the people, of course, they would be saying, I'll have to pray so that things will be fine. And when I pray about it, it happens. It's settled later on. Okay? So they would say, okay, I won't be consulting for other therapy anymore since I was able to make it through praying. I'm not saying that they should not pray. Of course, it's really needed to uplift somebody's spiritual things. And it's also a way of making yourself in a proper situation as well. Of course, we have different beliefs and practices at the same time. But of course, the importance of mental health practices should also be utilized. Another family-centered values, like what most Asians have. So there could be a reluctance to share things inside the family to outside circle. Okay? And colonial mentality, internalized oppression from historical Spanish and American rule, there could be an impact on self-formation and self-perception and identity formation as well. So you could notice that the culture is really a great factor in shaping one's practices and beliefs, even on the mental health issues as well. Now, for culturally competent approaches, we could have the following things. One important thing which should be considered would be the culturally sensitive therapy. It's very essential that we put ourselves in the shoes of a person so that we could really understand what is going on. Actually, even through readings, sometimes we could know something about it, but when it happens actually in reality, that's the only time you would really say, okay, I get it. I see the clear picture now. I know where is this person coming from. Okay? Sometimes readings could give information, but actual experience of that will really give a clear understanding about what the picture is all about. Next, community programs, outreach through trusted community organizations. There's a lot of organizations right now that's really focused on certain groups so that they could practice more based on the characteristics of those certain individuals and to customize the therapy or the interventions that will be provided for the individuals. Next, integrated approaches. It's a good thing to try a well area of therapies and intervention to make the success rate greater and more effective. So combining Western traditional healing methods could be utilized as you study the culture and devise something which could be applicable to for a certain client. Next. So we have here some success stories about culturally competent therapies. There is an Asian American Recovery Health Services. It's a San Francisco-based program which provides culturally sensitive or culturally responsive care. And they serve over 8,000 clients annually, and they have multilingual services. So we have mentioned one of the barriers a while ago, which is about the language. And so they try to train their therapist so that it could cater a wide range or a wide group of individuals coming from different nationalities. And then Asian Mental Health Collective created a resource directory connecting community to Asian therapists. There are also podcast series normalizing mental health conversations. And as we go along with these talks about mental health, it gives an education to individuals that when we talk about mental health, it's normal and it's not the thing into which we have this strong stigma that we consider a person insane or crazy. It's a wide range of education and letting people be aware about what mental health is really about. And faith-based initiatives, church-based counseling programs, Filipino communities, which integrates spiritual support with mental health services. So depending on the nationality, depending on the practices and the beliefs, there could be advances with regards to the study of the mental health. So in the case of the Philippines, since there is a very strong stigma about mental health, right now, I think it became better because of the mental health law, which was supported by the government, which gives a wider campaign to advocate the mental health practices. However, I still think that there are some people who are still closed in their thinking that mental health is something that really directs a person and makes a person who are suffering from certain issues as crazy or whatsoever. Okay, but at least it's getting better. So for now, are there questions or are there things that you would like to share? We would be happy to discuss about that.